press questions briefly, and then we'll let people go on and get some fresh air.
Governor, why open up the room like this? Are you trying to
the people's room?
In a sense,
sure, it's people's room. This is where democracy occurs. This is a public room. This belongs to the people of Minnesota. Well, all points of view are honored. Especially, I want to thank everybody here for being respectful of those different points of view. That's the great strength of our democracy, and I honor that. And I thank you all, every one of you, for your respectful conduct here today. Thank you very much.
Governor, given the passion of the people on both sides of this issue, how do you move Minnesota forward and unite Minnesota on this particular issue of health care as you move forward?
Well, this is what Tom Daschle, former Senate from South Dakota, calls the noise of democracy. I honor these differences. The fact that we can express them freely among one another and listen to each other respectfully, hopefully learn from each other, is the great strength of our state and our nation. So I'm just glad we're all able to live in a country as American citizens where we have this freedom, First Amendment right of expression.
Governor, with the broader budget problems and health and human services being such a large part of the state budget, what's going to be your strategy as you move forward over the next several months to get that under control and deal with those issues?
Well, I think that's a very good question. I think this allows us all some time, because it brings in these important federal funds to, again, healthcare providers. This money goes to benefit the low-income recipients, but the dollars themselves go to Minnesota hospitals and doctors and nurses and others who provide essential health care to all of these citizens and to all of us. And it's their voices I heard from throughout the previous months of my campaigning all over Minnesota. Hospital administrators, doctors, and others who stressed how this money enables them to get reimbursed at better rates for services they provide to low-income adults. It takes money off of the burden of the Health Care Access Fund and those state tax dollars, and asks the federal government, and Minnesota is one of the least recipients of federal money, to pay for this cost during a period of 3 years now where we can make these reforms, where we can make these improvements. But as we learned last spring from experience, when the attempt was made to quote-unquote reform GAMC and cut the costs, what happened was 21 hospitals around the state, if I have my number exactly right, were authorized to provide low-income health care services. 17 of them in greater Minnesota declined and said we can't afford to do so. So only 4 hospitals remained in the metro area for all the low-income people all over the state to go for health care services. That's a terrible burden on them. It's a terrible burden on their families. It's a terrible burden on those 4 hospitals, and it shifted the distribution of health care from statewide to just within the metropolitan area. This is a better approach over a period of time. It allows the legislature and our agency heads to work together collaboratively and effectively with the private sector, with the hospitals, the doctors, and other healthcare providers to keep looking for ways, more cost-effective ways we can provide health care to all of our citizens. Thank you very much.